Thank you so much for joining us here on Facebook. We are here for the Doctors In, and Dr. Nancy Wood with Children's Medical Group is here with us, and we are talking about cold and flu and COVID-19 pandemic. This is a different year than it has been in any of the years past, and I wanted to talk to you a little bit about what a parent can do ahead of this season.
Yes, absolutely. So there's really no magic tonic. There's no special pill or liquid that you can buy over the counter that would help your child be more protected against the coronavirus or the cold or flu. One thing parents can do is have their children vaccinated against the flu. That's probably the best bet as far as flu control is concerned. They can also make sure that their children are washing their hands frequently, make sure they're eating a good healthy diet, drinking plenty of water, and getting plenty of rest.
Awesome. And I mean, I know one thing that's a little bit scary during the COVID-19 pandemic is some of the symptoms are the same as a cold or flu. And of course, your head goes to automatically it's going to be the worst thing ever. How can a doctor tell the difference between the two? Is there a way?
So you're exactly right. The coronavirus is the great imitator, and it looks a lot like the cold and the flu, and like nothing at all. The symptoms of the coronavirus vary so widely. So there's really no way that a doctor can tell besides performing a very good history and physical exam and then the testing. The testing is the only way that a doctor can tell the difference between a cold, the flu, and the coronavirus.
And I know a lot of doctors this year are asking people to get that flu vaccine.
Yes.
That's something that they are really, really pushing this year because of the COVID-19 pandemic.
You're exactly right. We don't know what it'll look like if someone has the flu and the coronavirus, but I can't imagine that it would be a good thing. So we want to do our best to help not only prevent contraction of the flu, but also prevent the spread of the flu in the middle of the pandemic.
And we have a lot of people joining us here on Facebook. If you guys have any questions, we're reading through them right now, so please go ahead and ask those if you have them, as we have Dr. Nancy Wood here with Children's Medical Group. And we are talking about the cold and flu season and COVID-19 for those of you who are just joining us today. And I know, like you said, the vaccine is very important this year, but there are a lot of parents that have their kids in either daycare or school this year. What can they do to, you know, kind of alleviate any fears of anything, catching anything this season?
Sure. So there are some people who theorize that we will have a much less terrible cold and flu season because we're all wearing masks and we're all practicing our social distancing as we should. But what we just need to do is make sure that we're doing the best we can, right? That's all we can really do. So we need to wash our hands, we need to keep our distance, wear our masks, and just make sure we're taking all those precautions in order to help prevent the spread of everything, including the coronavirus.
And that's, I guess, kind of a silver lining of everything that's happening this year.
Yes.
Everybody's already wearing those masks and washing
Right.
hands very, very often. I know I am. We have hand sanitizer everywhere out
Yes.
here. And, you know, what a parent, I'm sure, is very concerned going into this season. As a doctor, what can you say to them to kind of help them maybe alleviate some of those fears?
Sure. So we've been very fortunate in that even though children can contract the coronavirus, it's been pretty rare. I've actually only seen 4 cases in my office, and the greatest silver lining is that even though a very, very small percentage of children do get very sick, the vast majority of children who catch the coronavirus don't get that sick. I'd be much more concerned about the flu or RSV than I would about the coronavirus in a child.
And we do have a question in here from a viewer, Jessica Hall-Turner. She's asking, you kind of answered this a little bit, but I want to ask her question for you. How likely is that small children under 5 can get COVID-19?
So it's possible, but it's very unlikely. Children have the benefit of having good, robust immune systems, and they also are not at the same level as far as height. You know, with adults, you know, they're not at the level where the sneezes and the coughs and the any spit that would come out of an adult's mouth, it all falls to the ground, and so adults are much more likely to transmit the disease to other adults. And most of the studies show that children are not only not catching the illness as frequently, but they're not transmitting it to those around them as we thought they would.
And how should someone know when to go to a doctor? I mean, be it with a child or for themselves because of this season?
Sure. So anybody who's had a fever for more than 2 or 3 days should absolutely be evaluated by their doctor. Anyone who's having any difficulty breathing needs to either go to the emergency room or call 911. And if you're just feeling particularly rotten, it's probably a good time to go in and see the doctor.
And what about testing? I know you can get COVID-19 testing a little bit more easily now than you could at the beginning of the pandemic. But when should someone consider maybe it's time to get tested? Should they be talking to their doctor, or is this something that they can decide on their own?
It's probably best to be evaluated by a physician before you undergo a test, unless you know that you've had exposure to the coronavirus. So if you know that you have a first-degree contact of someone who has been exposed, it's probably a good idea to be tested. The CDC has recently changed their recommendations on this. At one point they were saying you don't have to be tested, you just need to quarantine, and now they're recommending, probably, they haven't given an exact recommendation, but probably on day 5, 6, or 7 it's best to go ahead and be tested.
Good to know. And we have another question here from a viewer. Victoria is asking, is it possible to be diagnosed with both the flu and COVID?
Unfortunately, it is. You can contract the flu and COVID at the same time. You can contract the flu and strep at the same time. I've seen children who've had both strain A and strain B of the flu at the same time. So yes, it's possible.
And another question here from Ashley. Her youngest son, who is 2, has chronic asthma, and she is wondering and worried if he were to get the coronavirus, will the symptoms be, how will they be, what symptoms could they be, and should she worry?
So she definitely shouldn't worry. If she is concerned that he's sick, she should have him evaluated by his pediatrician. Yes, he could contract the coronavirus. It would be difficult to say what his symptoms would be. He may be completely asymptomatic or he may be very sick, but as his mother, she knows him best, and she should just really keep her finger on the pulse of what's going on, and if she feels like he's not getting better after contracting any illness, he should be seen by his pediatrician.
As with children, what is deemed as high risk? What are those high risk patients deemed as?
So certainly children under 12 months old are always at high risk when we're talking about upper respiratory tract infections of any kind. Children who have chronic illnesses, I would say severe asthma, diabetics, any heart conditions, those children would be at high risk if they did contract the coronavirus.
I mean, this is something that's been on everybody's minds for quite some time, and it doesn't seem to be dying down anytime soon. As just a general for parents at this time, what should they be doing just to make sure that their kids are okay? I know you said it's not as likely, but it is still possible.
Definitely, and we all need to remain vigilant. I mean, we all need to practice the social distancing guidelines. We all need to get plenty of rest, drink lots of water, eat good healthy foods, get a little bit of exercise every day. Just everything that you would do to remain healthy at any other point in time, we need to do that, plus social distancing and hand washing.
And I just want to kind of clarify this because we've got a couple of questions about the asthma. Is that something that's considered high risk?
You know, I haven't read any studies, but any upper respiratory tract infection, if you do have asthma, which is a lung condition, you might be more susceptible to the upper respiratory tract infection. And since that's what a coronavirus is truly it's an upper respiratory tract infection, yes, I would say that they are at slightly higher risk. But that doesn't necessarily mean that your child with asthma would be hospitalized if they were to contract the coronavirus.
Good to know. And obviously you want to continue to practice those safe guidelines, social distancing, washing hands, all of the above.
Definitely.
And you know, as we continue to go through this pandemic, is there anything in particular that they can do to make sure that they're not going to get a cold or a flu on top of coronavirus?
You know, I mean, it would be really wonderful if there was something specific we could do, but just those kind of general staying healthy tips is what we need to follow.
Good deal. Looking, if anybody has any other questions, please go ahead and write them in. We do have, like I said, had a couple questions about chronic asthma and if it's possible to be diagnosed with both flu and COVID. But I want to go ahead and continue to talk to you again about the flu vaccine and just kind of reiterate what you had said for the people that have just joined us.
Yes, so the American Academy of Pediatrics and the CDC both recommend that everyone over the age of 6 months be vaccinated against the flu. Some children might need 2 flu vaccines if it's their first year to ever receive it and they're under 9 years old. They would need 2 flu vaccines separated by 28 days. Everyone else can receive just 1 flu vaccine. At most pediatric offices and most offices in town, not only can you have the child who's being seen vaccinated, but any siblings, caretakers, grandparents, parents who are present may also receive the vaccine.
And to reiterate, I know we've already talked about this a little bit, but we have some more people that are joining in with us. We're talking about coronavirus as well as the cold and flu season, and you were talking about the symptoms. They're very similar, and how can you as a doctor tell the difference? Is it strictly just testing?
Yes, if we want to know whether someone has the coronavirus, the only way for me to be able to tell that is the test. Now, with a good history and physical exam, I can often tell whether or not someone has a cold or the flu. I typically do run a test to confirm my suspicions, but someone who had a fever on the first day of illness and has a little bit of runny nose and cough and is 3 or 4 days into it and doesn't feel that bad, that would be much more characteristic of a cold. Someone who just feels rotten, has body aches, is laid up in bed, has a lot of malaise, the fever persists, that is more characteristic of the flu.
And I know we had talked about this earlier, but again, as people are joining us in, I wanted to ask you again about how likely it is for a child to contract coronavirus during this season.
Right, so both anecdotally in my office as well as what I'm reading in the literature, it's a lot less likely that children are contracting the illness than it is adults, which is fantastic.
That is good. And I mean, have you guys seen a lot of cases yourselves?
We've seen a few cases in the office. Some of the rapid tests have come back positive, and often if the rapid test comes back negative, we send off a test to see if that one will be positive, and occasionally that one has come back positive too. Fortunately, no one that I've seen has been very ill from the coronavirus. I do know that there are cases that have presented to USA Children's and Women's Hospital kids who've been very sick with the coronavirus, so we must stay vigilant, but it's not something that is keeping me up at night yet.
That's good, and that's
yes.
encouraging to know. And like you were saying, it's not something that you've seen yet, but as you have seen a couple tests, what is the treatment period like? I know we all know about the quarantine, but what can you do when you're laying up in bed not feeling good?
Right. So you're considered infectious for 10 days from the onset of symptoms, or if you're asymptomatic and you test positive, we start the 10 days on the day the test is performed. So there's not a whole lot that you can do besides just monitor your symptoms closely. It's probably a good idea to take your temperature pretty regularly if you've been diagnosed with the coronavirus, and be very mindful of your respiratory symptoms. So how are you breathing? Are you coughing? Are you having any difficulty breathing? And if the answer to difficulty breathing is yes, that would be certainly the time to seek further medical care.
And that's important to know, because I mean, I know a lot of people are concerned. You don't feel well, and then of course right now you automatically assume the worst. Or I know some people do.
Oh, we've
not
all
everybody,
been joking. But yes, a little tickle in your throat and you're scared to death that you have the coronavirus.
Yeah, so something to look out for is difficulty of breathing, and that's when you should potentially seek help from a doctor.
Definitely. And in older children, they can tell you if they've lost their sense of smell and taste, and that is another hallmark of the coronavirus that would probably differentiate it from the cold or the flu. I'm sure that some people do report loss of smell and taste with a cold or the flu, just because sometimes when you're so congested you can't have those senses in their full facility, but that's definitely a hallmark of the coronavirus.
What should parents be watching out for this season with the dual kind of threat of cold and flu and COVID-19? What are the symptoms that they should be watching out for in their children and themselves?
Sure. So anybody who starts with a runny nose that worsens into a cough, if they run a fever, if they have body aches, if they have nausea, vomiting, if they have any eye symptoms, or the loss of taste and smell, those symptoms should probably be evaluated. They should most certainly be evaluated if you know that you've had exposure to someone with the flu or the coronavirus.
And you were saying earlier, which I thought was very interesting, is testing should probably, if you've been in contact with somebody, probably after about 5 days is
Definitely
the good time to go.
Yes, a lot of people want to rush out the day after they found out they've been exposed, so we'll get a call at the office. I just found out yesterday that the babysitter who was with us has the coronavirus. What should I do? And the answer is really just sit tight. You should definitely quarantine, so anyone who's had a first-degree exposure needs to quarantine for 14 days, and that's regardless of the test results. So even if you came in on day 5 and the test was negative, you would still need to complete your 14-day quarantine. But I would not have the child tested, or an adult for that matter, until at least the 5th day after the exposure.
or if they're presenting symptoms.
Sure, sure. If it were 2 or 3 days after exposure and symptoms started, at that point it'd be fine to be tested.
What is, can you kind of explain, because I know we've been talking about this 14-day quarantine period. Can you kind of explain why it is necessary to do that even if you don't contract the virus?
Right. So the reason that they've come up with 14 days is that that is the longest period of time that the physicians are aware of that someone who's been exposed has started with symptoms. So it's very unfortunate that it's 2 full weeks that people have to quarantine, that it's very inconvenient. It kind of just stops your life for 14 days. But you could come down with symptoms as late as the 13th or 14th day if you've had exposure to someone with the coronavirus.
And any tips that you can offer heading into cold and flu season and COVID-19 pandemic ongoing that people should be doing to remain vigilant?
Yes, so wear your mask, practice the 6 feet of social distancing, wash your hands frequently, get a good night's sleep, eat a good, healthy, balanced diet, drink plenty of water.
Awesome. Dr. Nancy Wood with us here with the Children's Medical Group talking about cold and flu season as well as COVID-19. Thank you so very much for joining us today. Is there any parting words that you would like to get out there as we still have the people watching us on Facebook Live?
Just everybody do your best to get your flu vaccine.
Thank you so much.
Thank you.